All right, this is a quick shoulder rehab program to help work on strengthening up the rotator cuff a little bit and just releasing some of that inflammation that's going in and around, most likely the AC joint or somewhere in that shoulder there. So we've got a series of some beginner stretches to work on. It's going to be followed by some isometric strength. Once pain has started to subside, I'm also going to be adding on some resistance band strength movements, but not to be done until the pain level goes down and these types of things here. So the first exercise, we're going to go for all these for about 30 seconds in length. We're going to do something called stir the pot. So we're going to have our feet just outside, shoulders apart, bending our knees, arm or hand on the other leg, and we're just going to work on making some circles with our arms. You're going to get about 30 seconds one direction, 30 seconds the other direction if you'd like. In this position, you can also start doing some rotation of the hand as well here. Okay, so that's the first one, 30 seconds, 30 seconds. The second one, you're going to find a corner of your wall here. And we're going to go 90-degree arms like this. And we're going to go arms up against the wall, stretching out the front side of the pec and the shoulder. Again, holding for about 30 seconds, so in that 90-degree angle there. The third one and the fourth one, we're going to use the foam roller for. So you're going to lay it down on the floor. You're going to be laying on the long way. So you're going to sit down with your butt on one end of it, and then you're going to lay the long way. So your head should be at the top here. Okay? A better angle. First movement, palms up. Trying to get your whole spine on the roller here, so our back isn't arching off, the whole spine is here. And we're just relaxing those arms straight out to our side. Taking nice deep breaths and just letting gravity stretch out those shoulders and arms and upper body. So you're going to hold that for about 30 seconds. From there, we're going to take a water bottle on the affected shoulder. And we're just going to stretch out the shoulder in that position there. Okay, just come up slightly. And then down. Up slightly. And down. If any of these generate any kind of pain or discomfort, obviously stop with those movements and take them out of the program until we can get some of that inflammation down. Next stretch called the sleeper stretch. So we're going to be laying on our side. Okay. Arms at 90 degrees. Hand is below the wrist. And you're just going to slowly guide that arm to the ground. Okay, so again, holding that one for about 30 seconds. We have some internal, external rotation. We've got a few different exercises we can do to help, again, stretch out that muscle tissue gently to allow that healing to continue to progress here. Okay, so those are the stretches that we're going to start with. Next, the basic isometric, which means we're not moving, strength movements. First one is getting those rear lats. And so we're going to stand about 6 inches away from the wall, and we're going to push the back of our the back of our hand right here against the wall, and we're going to be stretching and strengthening this part of your body. You'll also start feeling that up in the shoulder as well. Okay, so we're against the wall, affected arm, and you're just going to push, hold for 10 seconds, and relax. Push, hold for 10 seconds, relax. Okay, you're going to do that 3 times for a total of 30 seconds. The next one, again, affected arm here. We're going to press the back of our hand against the wall, getting some abduction, press, hold for 10 seconds, and relax. Same thing as last one, 3 sets of 10 seconds for a total of 30 seconds on there. So those are going to be the isometric strength movements that we're going to do it until we're relatively pain-free. We want pain, maybe on at a normal level at about 1 or 2 before we start adding these next exercises, which are the banded strength movements. So a few things we have here. We need a couple different resistance bands. We need to anchor them onto something. So if you have a post or something in your basement, but we're going to start off. The first one's start with a light band, and then slowly work your way up. We're going to go for 10 to 12 repetitions. You're going to pull the band towards your face and separating the band at the same time. So our aiming point is to our nose. Keeping those elbows nice and high. We don't want the elbows drop down, so elbows high. Pull, squeeze, and relax. From there, we're going to do some internal and external rotation with the band. So I would take a towel, kind of roll it up here, and we're just going to put that into the arm right there to give you a little bit of leverage, a little bit of support. Okay, so we're going to start from this external position, rotating to the internal position. So again, 10 to 12 repetitions. Turn around, face the opposite way. Starting from the internal position, working external. Okay, and then the last one. Working on some shoulder abduction. So again, kind of like what I did against the wall, but now adding movement to it. Coming out to our side and back up. Okay, you can use a light dumbbell or something like that, or again, even a bottle of water if the resistance is too heavy. Working some abduction as well. Okay, so those are your starting strength movements. So we have some stretches, we have some strength, and we have some secondary strength movements that you can be working on.